Welcome back to the Vital Signpost. We're diving into a condition you'll definitely see in your nursing career,
Absolutely.
Parkinson's disease.
Yeah,
Um, and as you know, this is a neurodegenerative disorder
right.
that really affects movement, and it can really have a big impact on a patient's quality of life.
And that's why we're here today to give you the knowledge and insights you need to provide truly exceptional care for your patients with Parkinson's. So we'll be unpacking the science behind this really complex condition. We'll be looking at the medications used to manage the symptoms, and we're also going to explore the role that nurses play in supporting these individuals.
So let's start by kind of getting a basic understanding. Parkinson's disease really affects one specific area of the brain
Right.
called the substantia nigra.
Yes.
And this area is responsible for producing dopamine,
Yes,
which is a neurotransmitter, and it plays a really crucial role in regulating movement.
it does.
The problem is that in Parkinson's, these dopamine-producing neurons start to die off.
They do, and that gradual loss of dopamine is what triggers this cascade of events that then leads to the characteristic symptoms that we see in Parkinson's. Think of it this way. Dopamine acts like a brake
Okay.
in the brain's movement control system, and as the dopamine levels decline, that braking system weakens,
Oh, okay.
allowing other neurotransmitters like acetylcholine to become overactive.
I see.
So this imbalance between dopamine and acetylcholine is what disrupts the smooth, coordinated movements that we take for granted.
So it's like this kind of delicate dance between these neurotransmitters.
Exactly.
And in Parkinson's, that dance gets really uncoordinated.
It does.
And we often hear about kind of the motor symptoms of Parkinson's, like tremor, rigidity, slowness of movement,
Right, and
postural instability.
right.
But it's really interesting that these symptoms often don't become apparent until a significant amount of those dopamine-producing neurons have already been lost.
Absolutely, and that's one of the challenging things about Parkinson's disease. It can progress silently for years before it really shows itself, and by the time a diagnosis is made, the damage can be quite extensive. In fact, it's estimated that when the motor symptoms appear, around 60 to 80% of the dopamine-producing neurons in the substantia nigra are already gone.
So that really highlights how important early detection and intervention is.
It does.
But it is a challenge with Parkinson's.
Yes.
So let's talk about those motor symptoms in detail so our listeners can understand the clinical picture.
Okay.
And we often use the acronym TRAP to remember those cardinal symptoms:
Great.
tremor, rigidity, akinesia, and postural instability.
It's a really helpful mnemonic,
Yeah.
especially when you're trying to remember the key features of the disease.
Okay.
So let's break them down one by one, shall we?
Yeah.
So first we have tremor, as the name suggests. Tremor involves involuntary shaking or trembling.
Wait.
And often that is one of the first noticeable signs.
Yeah.
And many people, I'm sure you've seen this, they picture the classic pill-rolling tremor in the hands.
Yeah.
But it can also affect the legs, other limbs, even the head.
Okay. So then there's rigidity,
Right.
which basically means stiffness or inflexibility in the muscles.
It does.
If you can imagine trying to bend a lead pipe,
Yes.
that's kind of the resistance that people with Parkinson's experience
Yeah,
in their movements. And this is often referred to as cogwheel rigidity
it is.
because the muscles seem to catch and release
Yeah.
in this jerky motion.
It's very characteristic, isn't it?
Yeah, and that rigidity can make even the simplest movements difficult.
Oh, absolutely.
So can you imagine like trying to button a shirt
Yes.
or turn a doorknob?
It can be very frustrating for them,
Yeah.
and really debilitating.
And then we have akinesia,
Right.
which literally means without movement.
It does.
But in Parkinson's, it often is bradykinesia.
Yes.
Yeah, so slowness of movement.
Okay.
People with akinesia may have difficulty initiating movement,
Right.
and their movements might become smaller and more hesitant.
Absolutely. It can affect all aspects of movement,
Okay.
from walking to speaking to even their facial expressions.
Yeah.
Their gait can become shuffling. They shuffle their feet when they walk. Their voice can become very soft and monotone, and their face can become less expressive.
Yeah.
We sometimes call that mask-like.
And finally, we have postural instability,
Right.
which basically means having difficulty maintaining balance.
It does.
So people with postural instability may have a stooped posture.
Yes.
They may shuffle their feet when they walk, and they have a really increased risk of falls.
And that's a major safety concern, isn't it?
It is.
And it's one of the reasons why falls are so common in Parkinson's disease. It's very important to assess and address postural instability to prevent injuries.
Absolutely. So these four primary symptoms, tremor, rigidity, akinesia, and postural instability really paint a picture
They do.
of the challenges that people with Parkinson's face.
Yes.
But it's important to remember that those are just the motor symptoms.
That's right.
Parkinson's can also affect cognition, mood, and sleep,
It can.
making it a multifaceted condition.
It is, you're right. It's not just about the physical symptoms, it's the impact on the whole person.
Right.
Their cognitive abilities, their emotional well-being, and their overall quality of life.
Yeah.
And that's what makes nursing care so crucial in Parkinson's disease.
Yeah.
You know, it's about addressing the needs of the individual on all levels, not just managing those motor symptoms.
And that's what we're going to continue to explore
Yes.
in this episode. We'll be talking about the different treatments available.
Absolutely.
We'll discuss the specific nursing interventions that can really make a difference in the lives of these patients.
We will.
And emphasize the importance of a really holistic and compassionate approach to care.
Yes. And we're also going to unpack the pharmacological and non-pharmacological strategies that are used to manage Parkinson's, discuss the role of the interdisciplinary team, and highlight the importance of ongoing assessment and evaluation, you know, to make sure we're meeting the patient's evolving needs.
So stay tuned. We're going to continue our deep dive into Parkinson's disease,
Yep.
equipping you with the knowledge and insights you need to provide really exceptional care for these incredible individuals.
Yes, stay with us.
Now that we've got a good understanding of Parkinson's disease,
Yes.
let's look at the different treatment strategies that we have.
Okay.
And you might be wondering, is there a way to reverse the damage or even cure Parkinson's?
Yeah.
And sadly, at present, there isn't.
Not yet.
But we do have a range of medications
I do.
and therapies that can manage the symptoms
Yeah.
and really improve someone's quality of life.
Absolutely. And that's a crucial point. You know, while we can't regrow those lost dopamine-producing neurons, we can certainly have a positive impact on how people experience and live with Parkinson's.
Okay.
So think of it like this. We're trying to restore that delicate balance between dopamine and acetylcholine that we were talking about earlier.
Right.
So we're aiming to either increase dopamine levels in the brain or block the effects of acetylcholine.
Okay.
And often, a combination of medications is used to achieve the best results.
So it's like we're adding weight back to the dopamine side of that seesaw
Exactly.
and trying to lessen the influence of acetylcholine.
Yeah.
And one of the key players in this balancing act is a class of drugs called dopamine agonists.
Right.
And these medications basically mimic the action of dopamine in the brain,
Yes.
helping to compensate for that dopamine deficiency.
They do. They step in and try to do the job of dopamine,
Oh,
stimulating those dopamine receptors in the brain.
interesting.
Now, dopamine agonists can be divided into two main categories: indirect acting and direct acting. So indirect acting dopamine agonists work by increasing the amount of dopamine that's available in the brain,
Okay.
while direct acting dopamine agonists directly stimulate those dopamine receptors.
So they either boost the existing supply or step in and do the job themselves.
Exactly.
Clever.
Yeah.
So one of the well-known indirect acting dopamine agonists is Siligilin,
Yes.
which is a medication that's often used in the early stages of Parkinson's disease.
right.
And Siligilin belongs to a group of MAO-B inhibitors.
They do.
So MAO-B is an enzyme
Right.
that breaks down dopamine in the brain.
It does.
And by inhibiting this enzyme, Siligilin prevents that breakdown of dopamine,
Yes.
increasing its levels.
It's like putting a protective shield around the dopamine
Okay.
to prevent it from being prematurely destroyed.
I see.
And that helps to prolong the effects of whatever dopamine is still being produced.
So in addition to dopamine agonists, there's another medication that's kind of central
Yes.
in Parkinson's treatment.
There is.
And it's often referred to as the gold standard,
It is.
especially in those later stages of the disease.
Right.
And that is levodopa.
Levodopa.
And levodopa is really fascinating because it essentially provides the brain with the raw materials
Yes.
it needs to make dopamine.
It does. Think of it as a dopamine precursor.
Okay.
It gets converted into dopamine in the brain,
Oh.
replenishing that depleted supply.
So it's remarkably effective in managing those motor symptoms.
It is. It's a real game changer for many people with Parkinson's.
Yeah.
However, there is a catch.
Okay.
Levodopa can be broken down in the body before it even reaches the brain,
Oh, okay.
and that limits its effectiveness.
Right.
So we have this clever strategy
Okay.
where we give levodopa in combination with another medication called carbidopa.
Oh,
And carbidopa acts as a bodyguard for levodopa,
okay.
preventing it from being prematurely broken down.
In the periphery.
Yeah, in the periphery.
Interesting.
This ensures that more levodopa reaches the brain where it's needed.
So by combining levodopa with carbidopa, we can get that therapeutic effect
All right.
with a lower dose of levodopa,
Absolutely.
which then minimizes the potential side effects.
Exactly. It's a brilliant partnership, really.
So while these medications can be effective in managing the Parkinson's symptoms,
Yes.
it's important to remember that they can also have side effects.
They can. That's a crucial point.
So we always have to weigh the benefits
Right.
against the risks.
Absolutely. And
Yeah.
that's where careful monitoring and patient education are really important.
Yeah, so one of the most common side effects,
Yes,
especially with levodopa and dopamine agonists, is nausea.
it is. And this is often due to the stimulation of dopamine receptors
Okay.
in an area of the brain that's involved in the vomiting reflex.
So it's like a side effect from the medication's primary mechanism of action.
Exactly.
Another common side effect is orthostatic hypotension,
Yes.
which is a sudden drop in blood pressure when someone stands up.
Right. And this can lead to dizziness, lightheadedness,
Yeah.
even fainting.
And that can be especially concerning for older adults.
Absolutely. Who are already at risk for falls.
So we need to be very careful in monitoring for these side effects
We do.
and really educate patients about strategies to minimize them.
Absolutely. And, sometimes simple things like changing positions slowly,
Okay.
staying well hydrated,
Yeah.
wearing compression stockings can make a big difference.
As Parkinson's progresses
Yes.
and higher doses of medication are needed,
Right.
other side effects might emerge, like dyskinesias.
Yes,
These are involuntary, jerky, or writhing movements,
they are.
and they can affect different parts of the body,
Yes.
and they be quite distressing.
They can be, but fortunately we can often manage them by adjusting the medication regimen.
Okay.
Finding that sweet spot between controlling the Parkinson's symptoms and minimizing the side effects.
So it's a process that requires ongoing adjustments
It does.
as the disease progresses
Yes,
and the patient's needs change.
absolutely. And it's a reminder that Parkinson's care, it's not a one-size-fits-all approach.
Right.
It's a highly individualized journey
Yeah.
that requires careful assessment,
Yeah.
ongoing monitoring, and open communication.
Between the patient and their family and the healthcare team.
Exactly.
Now, beyond medications,
Yes.
there's a whole world of non-pharmacological interventions
There is.
that can really improve the lives of people with Parkinson's.
That's a crucial point.
So,
Medications are just one piece of the puzzle.
right.
We need to take a holistic approach,
Yeah.
addressing not just those physical symptoms, but the cognitive, the emotional, and the social aspects
Of the disease.
of the disease, yes.
And that's where those non-pharmacological interventions come in.
They do.
So let's talk about those.
Okay.
Physical therapy is a really central role
Yes,
in Parkinson's care.
it is.
It can really help improve mobility, strength, balance, and coordination.
It can.
And specific exercises and techniques can target those classic Parkinson's symptoms, like rigidity and bradykinesia,
Yeah,
which help to maintain function
right.
and prevent further decline.
It's like building up their physical reserves
Okay.
to help them weather the storms of Parkinson's.
And beyond those physical benefits, exercise has also been shown to have neuroprotective effects,
It has.
which could slow the progression of the disease.
Right. So it's not just about symptom management.
Right.
It's about potentially modifying the disease course.
Amazing.
It is, isn't it?
And then we have occupational therapy,
Yes.
which focuses on adapting tasks and environments to make everyday activities easier.
It does. It's about finding creative solutions
Okay.
to those challenges that are posed by Parkinson's,
Yeah.
helping patients to maintain their independence
Yeah.
and participate in meaningful activities.
Yeah.
So simple things like using adaptive utensils,
Right.
modifying clothing, rearranging furniture can make a big difference.
So it's about empowering them
It is.
to maintain that autonomy
Yes?
and to engage in things that they love.
Yeah. Absolutely.
Now, speech therapy can also be really beneficial
Yes.
for individuals with Parkinson's,
Right.
particularly those who are experiencing speech and swallowing difficulties.
Yes. Which are very common as the disease progresses.
And speech therapists can help patients improve their articulation,
Yes.
their voice volume,
Right.
and their swallowing function,
They can.
which can significantly affect their ability to communicate
Absolutely.
and to eat safely.
Yeah, and also Don't underestimate the power of support groups
Right.
for both patients and their families.
Yeah.
Connecting with others who are living with Parkinson's can provide a sense of community,
Yeah.
shared experiences and emotional support.
Yeah. And it's a reminder that they're not alone in this.
Absolutely.
And they can learn from each other, share coping strategies, and really draw strength from one another.
Exactly.
So it's clear that Parkinson's care requires this multidisciplinary approach,
It does.
drawing on the expertise of many different healthcare professionals to provide comprehensive and patient-centered care.
It's a real team effort,
Yeah.
with each member contributing their specialized knowledge and skills
Right.
to create a care plan that addresses the individual's needs.
And at the heart of this team is the nurse.
Absolutely.
So let's talk about that specific role that nurses play
Okay.
in providing compassionate and effective care for patients with Parkinson's.
All right.
You, as nurses, are often those frontline caregivers,
You are.
spending the most time with these individuals
Yes.
and having a real impact on their experience.
Absolutely. You're the ones that truly see the whole picture.
Yeah.
The physical symptoms, the cognitive changes, the emotional struggles, and the impact on their daily lives.
Yeah.
You're in a unique position to assess, to plan, implement, and evaluate care that addresses all of these things.
And that's what we're going to explore in the next part of this episode.
Yes.
We'll dive into the specific nursing interventions that can make a real difference
We will.
in the lives of your patients with Parkinson's. From medication management and symptom control, cognitive support,
Yes.
emotional care, and patient education.
Absolutely.
We'll discuss practical tips and strategies that you can use
Okay.
to empower your patients, enhance their quality of life,
Yeah.
and support them throughout their Parkinson's journey.
We will. Stay tuned as we continue our deep dive into Parkinson's disease,
Yeah.
equipping you with the knowledge and skills that you need to make a real difference in the lives of these remarkable individuals.
Welcome back to the Vital Signpost. In the first two parts of this episode, we really took a look at Parkinson's disease, from those neurochemical imbalances to those different treatments that are out there. But as nurses, you know that providing exceptional care means more than just understanding the disease
Right.
and giving medications.
Yeah.
It's about taking that holistic approach,
Absolutely.
looking at all the individual's needs,
Yes.
and then always checking to see if what we're doing is actually working.
And that's where that final step of the nursing process comes in, that evaluation piece. It's so important to make sure that we're providing patient-centered care.
Yeah.
We want to make sure that we're addressing those immediate symptoms, but we're also looking out for any unintended consequences.
Yeah.
And we need to be ready to adapt our approach
Yeah.
as the patient's needs change.
So it's not just a one-time thing.
No.
At the end of a care plan, it's constantly happening.
Exactly.
It's part of everything we do with the patient.
Yes. And with Parkinson's disease, it's especially important because the way the disease progresses can be unpredictable.
Yeah.
And people respond differently to treatments.
So we're not just going through the motions.
Right.
We're asking ourselves,
Right.
are we getting the results we want?
Yeah. Are the tremors getting better?
Right? Is their movement improving? Are they having side effects from the medication?
Exactly.
Are there other things going on that might be affecting how they respond to the treatment?
And that's where we really need to gather information from different places. We can use things like tremor rating scales, but we also need to hear from the patient.
Right.
How are they feeling? Are they seeing any improvement? What's still difficult for them? What's important to them in terms of their quality of life?
And that's where nursing really makes a difference.
It does.
Because you connect with the patient, you listen to them, and you use what you learn to guide their care.
Exactly.
It's about seeing the person,
Yes.
not just the disease.
And remembering that Parkinson's affects the mind and spirit too.
Right.
So we need to check their cognitive function, their emotional well-being, how they're sleeping, their overall quality of life.
Yeah.
Are they anxious or depressed? Having trouble with their memory? Are they able to do the things they enjoy?
And using all this information that we get,
Yes.
we can then decide if we need to change the care plan.
Exactly.
So maybe we adjust the medication dosage,
Right.
change the physical therapy routine, add some cognitive exercises, connect them with a support group, or even just listen and offer support.
And remember, evaluation is a team effort. It's not just you, it's the patient, their family, and the whole healthcare team.
So everyone brings their own perspective
Yes.
and expertise.
To ensure we are providing truly comprehensive care.
As we wrap up this deep dive into Parkinson's,
Okay.
I want to highlight how important it is to keep learning and growing professionally,
Absolutely.
especially in this field,
Yeah.
because Parkinson's care is always evolving.
It is.
New research is coming out all the time.
Yes.
New medications are being developed.
Oh, right.
And new approaches to care are being explored.
So as nurses, we have a responsibility to stay up to date on all these advancements.
To make sure we're providing the best care possible.
Exactly.
So attend those conferences, read those journals.
Yeah, talk to colleagues.
Keep looking for ways to learn and grow.
Absolutely. And, caring for patients with Parkinson's can be challenging, both physically and emotionally.
Right.
It's a chronic, progressive disease, and there's no cure.
Right.
And it can take a toll on the patient and the caregiver. Yeah.
So please take care of yourselves.
Yeah.
Make sure you're practicing self-care, find support when you need it, and celebrate those small victories.
Yeah.
You are making a real difference in the lives of your patients.
Yeah.
Your expertise, your compassion, your dedication, they are all invaluable.
Thank you for joining us for this deep dive into Parkinson's disease.
Yes, thank you.
We hope you found it informative and helpful.
We did our best.
Until next time, take care.